Masala Radio.
It is my pleasure to have on the radio Dr. Sheth. He's a medical director of Medijube. He's a CEO MCFI. I've been talking about MCFI. I've been talking about government $2.2 trillion stimulus package includes some money for small businesses. Every small business city, if you've got people that you know that have small businesses, like you could even be a realtor.
Oh, wow.
You could be an I should not say those GRE words.
Aesthetician.
Aesthetician. I should not say words I cannot spell. I'm one of those guys that's gonna make my parents not so proud when I go on stage for a spelling bee. And all the white guys are like, oh, this brown guy comes, he's gonna nail it, and I'm not. I'm really bad at spellings. But if you got people that you know, hairdressers and makeup artists that have their own business, have their own federal ID, they can get $10,000.
Wow.
In the stimulus package. And it's still not, last week I talked to Jay Sheth, it's still not out there, on CNN and all that. They're not really talking about it. That's why Jay Sheth is here. He's fighting coronavirus in the front lines. Please welcome Dr. Jay Sheth. Good afternoon, Doc. How are you doing?
Good afternoon.
You've been fighting with your crew at your hospital, and just kind of wanted to check up on you to see if are you seeing a surge from last week to this week? Have you seen any change? Has there been any noticeable difference in our ability to detect and test and accommodate patients and hospital beds? And can you give me an update?
Sure, absolutely. I think there are quite a few of the developments. Overall, lots and lots of testing is available around the country.
So now there's there's this common, I think, misconception. Everybody seems to think, still do, when I talk about tests on radio, this or that, people still think, oh, these tests, what tests? It takes 2-3 days to come back. But I heard of some tests now that takes like immediate results.
Correct. It is 15 minutes, and so those are called spot tests or instant tests.
Are they as good in detecting the virus as the ones that go in the lab?
Correct.
Okay.
Those are screening tests again. It looks for the antibodies that is created by your body once you have the viral infection. And these are spot tests that is available all over the nation. Still, recommendation for mass testing is not there, but you do have plenty of testing available. These are called screening tests. So, if somebody has a suspicion that, hey, I have a little cough, or, felt a little feverish, or I have exposure, somebody, my, colleague or somebody passing by, healthcare workers, you can test on them and really figure that out if they have the coronavirus infection or not.
Okay.
So that is a great news. In next couple weeks, we will be doing mass screening. So
what do you mean mass screenings?
So what we look to do is, once we have many of these tests available, as we get back in this economic activity, we open up the businesses, and while we will continue to do physical or social distancing, as we are calling it now, but we would get the testing done on those people. And you would know that many of these people has already had coronavirus, and now they have the antibodies. Or that many of the people just cleared, they don't have the test, positive test, and so they can get back to work.
How long, Doc? How long do the antibodies last in your body? Like if you get coronavirus, do I have antibodies to fight it if I get it again?
Yeah.
Correct. So there are two types of antibodies that our body creates. One is called IgM, and IgM is positive. IgM test means you have active coronavirus infection if that is the only antibodies that is positive. At about 14 to 21 days from infection, you start developing IgG antibodies. And once you have IgG antibodies, that means your body is clearing of the viruses. IgM antibodies start clearing, and 21 to 28 days, IgM antibodies are gone, and IgG is the only one that stays in your body. So once you have IgG starts appearing in your body, the virus your body is fighting, and there is a long-term antibodies that would be present. So it is a cycle in which you look for both of those antibodies in the test. You look for both of those test results, and based on that you decide.
Doctor, I actually have another question. So
I've got Siri here, and she also is from the medical field, and she's a co-host on the radio, and she was telling me she wanted to ask you a question.
Yeah, so with the antibodies and stuff, so we've been having a lot of people asking for plasma donors of people who have been...
Yeah, we got some cases here, and we are promoting them.
Who have been infected. So they're asking for donors who have been infected and recovered from coronavirus. So is that kind of what is the antibodies, what they use to put into the patients who have it right now to help them recover?
We use those IgG antibodies.
Okay.
Those are the antibodies that would fight the virus. And we use plasma. So we don't wait to separate just the antibodies, but we take patients' blood, those who have already had that infection. Very interestingly, one of the cardiologists friend of mine from Louisville moved on to Dayton, assistant professor at Wright State University, cardiology. He was in ICU on ventilator. We sent out a nationwide search for somebody who has the same blood group type and has recovered from COVID-19. We found a donor for him. He received the transfusion. He's off of ventilator, out of ICU. So I think that will be the benefit of doing screening, in addition to getting the economic activity back, for us to be able to treat these patients who has severe disease, who are on ventilator. At that time, you give them this plasma, which is mainly the antibodies, to them IV. It is like blood transfusion. That's all you have to match. And part of the blood you are transfusing, and you see a very good recovery.
Yeah. So you've seen this actually work in patients. Do you have like a recovery rate, or what percentage? Is it like a guaranteed recovery if you do this?
Well, it is one of the treatments that I want everyone to know that was used even 100 years ago in the 1920.
That big flu, the
Spanish flu.
Yeah, Spanish flu.
Correct. At that time, we did not have antiretroviral medications, so that was the gold standard of treatment used, and we use that in many immunological related diseases. These coronavirus infection, people who are getting severe disease, it is considered to be more of an immunologic reaction, and what is called a cytokine storm. It starts at about 8 to 10 days from you starting to have the disease, and that's where it is helpful. So it is one of the proven therapies. In the beginning, we did not have many people available.
Who had recovered. You didn't have anybody that had recovered. And so, but now you do. I mean, there's like hundreds, and now we got 420,000 people. That's a lot of people.
Yeah. So this is the plasma transfusion is like a treatment, but not a cure, right?
Yeah, that's just a treatment. It doesn't really
cure.
So
do you know, or do we have any like sort of idea if anybody is working on an actual cure, or how far we are?
Yeah, how far are we? That's a good question.
Yeah.
You're a doctor out there working in the front lines. Do you know anybody that's close, or any people that say, hey, we found something, and are we close to getting a cure, Doc?
We do have pretty significant, but I want you to understand some basic things about viral disease in general, specific in this COVID-19. COVID-19 is otherwise a self-limited disease. 90% of people would get better on its own without treatment.
Oh, really?
Correct.
How come I'm not, a lot of things that you say is like, and I've not heard, I wish there's an Indian lady that stands on the right side of Trump. I'm not sure what her name is. I wish you could be out there also, again, with Dr. Fauci, saying some of these things that it would, from a medical perspective, it's the first time I'm hearing that this is a self-degenerating disease.
Self-limited disease. And Dr. Seema Verma is who you are talking about.
Ah, Doctor, yes, Seema, yeah, she's always on the right side of Trump.
Correct. Seema is doing a great job. She heads Center for Medicaid and Medicare Services.
Oh, okay.
CMS.
Okay.
So the key aspect for us to know is that those people who get severe disease, it is not the virus in itself, but it is the uncontrolled reaction of the person's body, in which what they get is what is called a cytokine storm. That is, the cytokine is one of the mechanisms to fight this virus, and our body starts firing or misfiring the cytokines. And so there is a huge amount of cytokines in our body. In addition to virus, those are also, it is like misfiring, so it also attacks our own body. And because of that immunologic reactions and inflammation that it creates in the lungs, person is not able to oxygenate their blood well in the lungs, and so requires support, ventilators, the breathing support and the oxygen and all of that. During that time, you give this IgG, which is what the body should be firing, and that helps to reduce that immunologic reaction of the body's own cells. So it is more of a supportive treatment. It reduces the immunologic reaction, inflammation that is created. And once you give that for a few days, after that the person naturally recovers from that coronavirus infection, is able to now really do the oxygenation on its own, the body, the lung tissue, and you are able to come off of the ventilator. So that is the mainstay. You asked me a question about what treatments we have. There is a hydroxychloroquine that is talked about.
We keep talking, yes, and there's a lot of news about it, and Modi is not shipping it, and maybe he will, but that hydroxychloroquine is a malaria disease, malaria cure, and it works for this?
Correct. So how it comes to know is that anti-malarial medications, chloroquine is something that we have known. All of us visiting India or many of the Asian countries, African countries, you do take anti-malarial prophylaxis.
Yes, we do. That's true. Yeah, we do the anti-malaria. Even when I went to I went to Masai Mara, and they made me take that anti-malaria medicine.
Exactly. So how does that medication work? So malaria is a parasite, and these anti-malarial medications changes the way your body, the coronavirus is sticking to the receptor, going in your lungs, in your throat, in your nose, and it does not allow it prevents it from kind of getting attached to the virus's receptor. And that is how it prevents it. That was tried and utilized for its effect in diseases like HIV. In diseases like, how they found is, and currently from New York, some of the rheumatologist friends who treats lupus, and they also use this anti-malarial medicine. In specific, hydroxychloroquine is used for treatment of rheumatoid arthritis and lupus.
And it could work here. It could work here.
Or correct.
Could it work here, or it's actually being tested on people and it works?
No, there is a significant evidence about those people who are receiving hydroxychloroquine for other diseases like rheumatoid arthritis and lupus. It's a brand name we use in the U.S. is called Plequenil. And that medication, Plequenil, people who are on Plequenil, in the rheumatologist's opinion, their patients who are taking these medications, they have yet to find anyone who has gotten coronavirus disease. I'm talking about in New York,
I see.
people who are treating these diseases. So that is why it is thought to be preventing the disease
Preventing the disease from happening in your body.
happening or the severity of it.
Or the severity. A lot of people have it, don't know that you have it. You don't see the symptoms. We've been getting some people.
Yeah, speaking of prevention, we have some questions.
Some messages that we've been getting, and so let's shoot some messages.
Yeah,
And
so some
Dr. Jay Sheth is a medical doctor working in the front lines in the hospitals in Atlanta. He's also the medical director at Marijuve here on the air with us. So the question.
So some of our listeners are wondering if it is safe to go on walks during this time, like
in the neighborhood. Is it safe to go in a neighborhood walk?
Yes.
It is.
It is safe. I think that we have to look at how this virus spreads. Okay. The reason why we have come up with physical distancing plan, and that is the community-wide physical distancing, is people who are asymptomatic but having the coronavirus disease, they do not know. So if you go out for a walk, you're on walkway, and somebody else is there jogging, let's say, and passes within a couple feet of you and does not know that I'm the one that jogger, I have the disease, I'm asymptomatic, but I'm sweating and, spilling my sweat all around. I just zoom by and you are getting that, the spread of the disease. That is the fear, because we know that is how this disease spreads, close contact or droplets airborne. So that is why it is okay to go, but you want to keep physical distance. I go out for walking. When somebody comes in, automatically that person goes a little bit away. You go a little bit away, and you are off the footpath, and there you go. You pass by that part. So
what to do on our daily lives? What to do? We're just getting clarification from. And what was the other question that somebody just called?
They said, is it also safe to go to grocery stores?
We get this question, I get in the last week said, hey, next time you get Dr. Sheth, I want to ask him, we go to the grocery store because, my wife really wants to go regularly and buy this, buy that. I said, I think regular grocery store is not a good idea, but when I have Dr. Sheth on, I will ask him, is it okay to go to the grocery store? Or if I do have to go, how do I protect myself?
Correct. So there are a few things. Number one, as little as possible going to the grocery store. Number two, there are a few recommendations that I would provide that is based, there is no clear research that says you do so. It's common sense. Put a mask on. Go at a time when there are not too many people, right? People are home early in the morning. Grocery stores open at 7 o'clock. Earlier in the day is a better time. They also have a time at night time to clean it. They sanitize the stores. All these carts and everything is sanitized. You do want to clean your carts. You do want to wash your hands. Common things that you want to do. So it is okay. It is safe to go to grocery store. There is something I'm going to mention, and that is the instruction I am provided. My wife, who is also a physician, and she has presented the research to me. There is a severity and mortality of the disease. We don't know the reasons. It's twice in the man than in women.
Oh, really?
So that is absolutely correct.
Just the data suggests that there's twice for men than women. So men are more. And I was watching CNN. They were saying something about the African Americans also. It's affecting him more. I don't know how true that is, but your wife, who's a physician, is saying that the severity for this is twice for men. We got to be more careful.
Severity and mortality.
Severity and mortality. Okay.
Too many times to double the mortality in. So, for every one woman dying from coronavirus disease,
there's two men. Two men.
And that is a pretty significant statistics. I have advised, and I do advise to all community, all friends. I think that men would say generally, hey, you go get the grocery. Reduce your exposure to unknown as much as you can in going for grocery. No bias. I'm advising that if you have a choice and option, let the boss go to the grocery.
Yeah.
That is one thing. Now, talking about leaving the house, there is something else I do want to talk about. There are a few recommendations we made about everybody, doing this 5 recommendations. There is one recommendation that I would like to add, and that is intake of vitamin D, in specific vitamin D3. In a limited amount, everybody should be taking that supplement.
Vitamin D.
Vitamin D, D as in David. Why?
Okay.
Because it is a vitamin that our body produces from sunlight.
Oh, and we're not going out so much.
We are not going out so much.
Ah.
We are in the house. We are in the basement. We are, not. And so it is very important and helpful to get vitamin D supplements. And many of the people of Indian origin are deficient in vitamin D to start with.
Yes.
Because of various reasons. But there is one important thing. Vitamin D is also a fat-soluble vitamin. So yes, you can take too much of it. So don't take too much of it. There is a recommended dose. That is prophylactic. That is something that you should take as a supplement.
How many? So vitamin D that you get in GNC or you get in grocery stores, what is the dose that I should be taking?
So vitamin D dose, it comes in the international units, and most of those are medications that is available that you take one a day. They usually don't sell those in high dose.
I see.
Vitamins A, D, E, K. So those are the ones that you do not take too many of those. If many of people take fish oil.
Yes.
Right?
Yes.
So
fish oil.
That is a kind of a combination of the vitamins A, D, E, K that you should be taking. You can take one of those available
in a store. Vitamin D.
In GNC, that vitamin D, yes.
So last week you called in, and last week you were telling us, and I've been telling everybody every single day, vitamin C, 1 gram, 1,000 milligrams, zinc, 50 milligram, and I also had a message on a Masala WhatsApp. Anupama, she's asking, I couldn't find zinc. All I found was zinc picolinate. That's how she types it. Picolinate.
Correct.
Is that same as zinc?
That is correct. Zinc picolinate is actually a good type of zinc.
Okay.
That is available in 50 milligrams. You could take that.
Once a day. Okay.
So once a day.
Okay, that's good. So, Anupama, that answers your question. Zinc, 50 milligrams. And apart from vitamin C, Doc also recommends taking vitamin D, 1 tablet a day, because we're not going out as much. We're not getting as much sun.
And then we also wanted to ask another question about when do you think that the peak of this whole epidemic will be in?
Is that what the guy called in for?
Yeah.
So, that's one thing. That's another one of our common questions. Hey, when Dr. Sheth is on, ask him in his medical opinion and now that you mentioned about the self-limiting, it makes more sense that even if we don't get a cure, that in a matter of weeks it will sort of diffuse. When do you see this peak happening? Because we have still not, I don't see a decline in the number of cases or deaths.
You are going to have increase in number of cases. What we are trying to do is we are trying to slow down that increase. So all of us are not getting that at the same time. So in next 6 to 8 weeks, we are going to go up on the cases and hospitalization as well as the ICU and deaths. So that is my kind of opinion, that it is going to be different at different communities, but you will have the kind of peak and plateau coming in most of the communities around the nation in next 6 to 8 weeks.
In the next 6 to 8 weeks. So you have a feeling, because it is self-limiting and because it is going to diffuse itself, that after this peak we're going to see more and more. But in the next 6 to 8 weeks, so April, May, you have a good feeling that by June things could get slowly back to normal. And Trump, just this morning, I was watching the news, he was saying that, or somebody in the White House said that he may ease on the work from home restrictions soon. So is that all because of the advice that he's been getting?
That is correct. So what we would do is, now we appear to have already slowed down the course of spread. And once the spreading of it is, we already have tests available, which we did not have. We already have, hopefully, it has already opened up, just the India saying that we are going to release these medications, hydroxychloroquine. Healthcare workers already are taking it or should be taking it. That helps in the severity as well as slowing the spread. So our systems are not, healthcare systems not going to be overwhelmed. With that part, we could open up the economy, so to speak, or let people get back to their work, continuing precautions. We are now recommending that you do use face mask. So while you go out for jogging, walking, grocery shopping, you should put face mask on. And so gradually you will see opening up of the essential, semi-essential businesses, and then getting back to, it is not going to be same as it has been pre-COVID-19.
It is not going to be same. That is very interesting. Dr. Jay said, fighting the front lines in the hospital, on the air, saying even though this is self-limiting, it will sort of clear itself out on its own within some time, but things will not be the same. In what way, doctor, it will not be the same?
I think that, number one, this coronavirus disease, we are going to most likely get trickle-down effect over a longer period of time, and maybe also in few more seasons. Till we have
few more seasons? You mean few more years? Like every year it's going to come up?
Yeah, that is likely. The second part is that we are going to have lots of things we are going to change in the way we are doing things, right? That is from the preparedness standpoint, availability of the medications or the PPEs or the treatments, vaccinations, how we are conducting our business in day-to-day life, how we are behaving. So all of those parts going to change. There is a one medication that is very, we are very hopeful for. It is an antiviral medication, which is the treatment of viral disease. All of the other things we have talked about is prevention or preventing the effect of the virus.
Right, but this is
treatment of it.
I see.
It is a Gilead Pharma, and the medication has Desi word in it.
Oh, really?
Remdesivir, REM, Remdesivir, DESI. I call it Remdesivir.
Remdesivir. So is this like the vaccination, somewhat similar?
No, it is a cure.
It is. I see. It's a cure.
It is. I should not say it is a cure. It is being tested for cure.
Okay.
It is all the medications that has been tried against Ebola, SARS,
okay.
MERS, some of the other viral diseases, Zika, and it is under phase 2 and phase 3 trials in different places. Gilead Pharma, it is also available as a compassionate care for those people who want to try those medications.
Right.
There are trials available. So those who are sick and who want to try those, they can get enrolled in the trial and can get those medications.
Well, do you foresee a vaccination coming sometime soon, so that because you're saying it might repeat itself, it may come back? So if I get a vaccine, just like I got a tuberculosis vaccine when I was young, do you foresee a vaccination coming soon?
Very, very likely, because there are several companies, as you know, the mRNA. There are other companies, Tonix Pharmaceuticals. They are all trying different vaccines, so they are at different phases of it. And in next year or so next season,
we might have a vaccine by the next season. We should invest. I should be investing. I should be buying some stocks in some of these companies that are working on it, because whoever puts it out is it's going to be big. It's going to be huge.
So mRNA is one of the symbols that is doing it. Moderna. There is another one that is Tonix Pharmaceuticals. It's a penny stock, 70 cents or something right now. And yes, I think that if you are on the biotechnology space, then those are the stocks you could look up.
Yeah, we were talking last week about Carnival, and I did some research after you were saying that you have a good feeling that, and you yourself bought Carnival. I was looking up, and the Saudis have invested in it, and it does not look like that stock is going to go down. And I bought a little bit more, just a little bit more, and it went up a couple of dollars. So you got me on the right track, Doctor.
That was a great. It was good to see that relief that Saudis bought 8% stake in it. I agree. It is going to go hopefully a lot better than we were expecting, but
yes.
That stock is not going anywhere.
Yeah, not going anywhere.
It's close to my entry point right now at about $12.
Yeah. One question that I'm not quite sure if I understand, but I'm getting all these messages. You can WhatsApp, and I see it on my screen. So I've got this big screen here, and this the reason why I put this message out is because I'm not understanding myself. Maybe you can make some sense of it. Caltrate for women has calcium, vitamins D3 with magnesium. Is that good enough for your vitamin D that you just recommended?
Yes, it is good enough. Calcium is vitamin D. So calcium is good for bone health. Vitamin D3 is also important for bone health, but vitamin D has also the immunologic protective mechanism. It helps with the cell's immunologic function. So vitamin D3 is good enough for those who are already taking it. Absolutely.
Thank you so much, Doctor, for being out there on the front lines and helping others and coming on air and taking the time out to keep everyone updated about the virus.
That's so wonderful. Yeah, he knows a lot about fighting this. He's working it. He's fighting it out there. He also, Doctor, we're gonna talk Friday same time, and we will post this. CD, I want you to post it everywhere that Friday 6:30 we'll talk to Doctor, and we are gonna one more time gonna go over the grants for small businesses and the loans for small businesses. And a lot of people didn't know. You did not know
I didn't
about
know.
the hairdresser. Even if you're a hairdresser and you file taxes as a hairdresser and you got a federal ID, that you could be eligible for a $10,000 grant. And if you got some employees, then 8 weeks you didn't know. We got to spread this message. And MCFI USA is a company that Doctor is a chairman of, and that company is going to help you file all this for a very small fee only after you get the money. It's essentially service. It's essentially community service. Doc getting on the radio, helping people, answering people, telling people. So we appreciate you. Your time and sharing with us what you know so far, and also not just about Corona, but also about how small businesses can benefit from this free money that he said.
Wow.
Free money government is giving you. So why not you? Why should you not? Every single federal tax ID, if you have filed a 2019 return, if you have a federal ID and you have employee, what was the date, Doc? You said as long as you had employees as far as December 31st, the date that...
Yes, it is a January 31st.
Okay, January 31st. January 31st, and for the businesses, they have extended that into February. But that is the time. One very important information.
That is something that many of the people who even have the knowledge of it may not know. If you have been an independent contractor, not an employee anywhere.
What's an independent contractor? Okay.
That means you are receiving 1099.
Right.
You are eligible to receive this benefit.
Oh, really?
Correct. So, like physicians, like the nurse practitioners, like many of the service industry folks, they go work nurses. They go work someplace for 2 days a week, and they are independent contractors. They are not employees. Their businesses where they were working may have been closed down. No source of revenue. Yes, this particular $10,000, we are able to get that to many people who has called us, and they are asking that, hey, we have not been employed. We have not had EIN number and formally formed the business. But we were working somewhere. We are independent contractor. We are able to get them also this benefit and qualify them for that part. So that does hold important for many of the folks who have been doing the projects, has been consultant, working as independent contractors. They should feel comfortable to reach out to us, and we can at least get them this $10,000.
Wow. So that is, even if you get 1099 independent contract, did this just happen now, or is that a change in the policy, or this is what they had already thought about?
This is something that was part of the original bill that was approved, that became law, that became act. But when the guidelines were put in, those were hidden in like a footnote, right? That what is your qualification? And as we reached out to SBA, we could qualify some of these people. It does take a little more of approving.
Right. But all this process, MCFI USA is gonna do for you, $10,000 grant, 8-week salary for entire staff. If you want to find out if you can qualify, I'm going to give you a number. Everybody should write this number down and pass the number to anybody you know. It's if you don't, you want to be generous. You don't want to give people money, but you want to give a number that'll help them get $10,000. 888-712-5284, or just Google MCFIUSA.com. Dr. Jay Sheth he knows so much about.
Yeah, you sound so knowledgeable, and I'm in the medical field too, and I've been thinking about taking my MCAT, and I just wanted to ask you, what is your MCAT score?
What was his MCAT score? Do you just ask him what was your MCAT score? She was just, she's been telling me in the break or whatever. She was like, "Wow, this guy knows so much about everything." And you did just ask him his MCAT score, Siri?
I did, but I'm just kidding. You don't have to say it on there.
Well, I would tell you something that my daughter is also taking MCAT. And one of the things that I am telling her is that MCAT should really move on to pass and fail.
Oh,
because remember, your score in MCAT or USMLE does not correlate with how good a doctor you are or you can become. And my test, this is very important for everybody to know, not only in medical profession, in all the professions. The most important thing for you to be successful in any profession is that you're gone in that profession because you loved what you do. And you have to be a good human being first. It's a people's business. Most of these things are the approach. It is technical aspect. Like my good friend who is now in Houston, Jignesh Derasari.
Yeah, Jignesh Bhai, yes.
Jignesh and Punita, she is a respiratory therapist out in the front in the hospital working, fighting this COVID disease. You always said one thing. It is the rest of things are technical that can be taught, that you can learn. But you really want to enjoy what you do, love what you do. You get in there, and 90% of that is taken care of. Okay, so. That is my thought about it. USMLE, fortunately, has moved on to pass and fail. Excellent. because it doesn't matter. Once you pass it, you are good.
Yeah.
You have made it. You have enough knowledge. So that is my word to you about healthcare. I would go ahead and say that you should keep up with taking that, going for it, and it is the most noble profession in this world.
Yeah, thank you so much.
Yeah.
Honestly, thank you so much. You're amazing, and all the medical professionals that are on the front lines.
Yeah, I want to give a shout out to everybody. We got a lot of people that are going to a huge medical center here, and people are fighting this, and we commend you. We applaud you for the great work that you guys are doing. Doc, thanks for sharing this wonderful update with me today. There was some good news out of this, and on Friday we'll talk about the $10,000, and now we'll even expand on the contractors, the 1099 people that get 1099s. If you're an independent contractor, you can also get the $10,000. So why not? And MCFI USA will help you. Dr. Jay Sheth, MD Ameriju, thank you so much, and have a safe and wonderful day. And we'll talk to you on Friday.
Thank you. Be safe.
Yes, sir.